there, I'm Shawna Robins, founder and CEO of Third Spark Health, and today I am doing an interview with Dr. Alyssa Dweck. She is the Chief Medical Officer at Bonafide Health, and she's a practicing gynecologist at Well in New York City, which provides health care to women of all ages and has delivered thousands of babies. Dr. Dweck is a Menopause Society certified provider and has a special interest and expertise in female sexual health and medical sex therapy. She's been voted the top doctor in New York Magazine and Westchester Magazine. Thank you so much for joining me today. I really appreciate you being here.
You bet. My pleasure.
Yeah. So tell me how you got started in the health and wellness field for women.
Yeah, well, I guess it's sort of a long, circuitous story, but I am kind of a math and science gal and have been for some time. Randomly, I applied for a job when I was, in high school or maybe even a little younger than that. And I applied at a hospital that was near where I worked and where I lived. And lo and behold, where did they put me? Into the labor and delivery suite of this hospital. And the rest is just history because I was just completely drawn to the drama, the excitement, the fun things that were coming in and going on, and the energy of the practitioners there. So I really got interested in the healthcare field, but very specifically in women's health because of that experience.
And then what brought you into the menopause space?
Well, it's funny. In gynecology and obstetrics, of course, your patients kind of age with you. So, we start out seeing tons of teens and looking to deal with contraceptive issues and, hormonal issues during menstruation. We move into childbirth and fertility, and then naturally our patients age a little bit into the perimenopausal space and eventually menopause. And it kind of goes along with our own age. So it's all very neatly packed.
So do you feel like your training in OBGYN actually helped you with menopause? I mean, I hear so much that there's not enough training on menopause, in
Yeah.
medical. What
You
is your thought on that?
Yeah, you are quite right about that. So I would say that during my medical school training and also residency training, the education surrounding not only menopause, but perimenopause, nutrition, hormonal health, hormone replacement therapy, all things that are really top of mind in my practice right now was minimal, really minimal. And I am not alone in having that experience. I think times are changing a little bit, but I would say during my tenure, a lot of it was learning on the job, but also really pursuing training in the perimenopause and menopause space and sexual health spaces, quite frankly. So certification has helped. A lot of my colleagues are interested in similar fields. So there's a lot of collaboration right now.
Okay, so talk to me about perimenopause. I know that for me, 47 was the number, was my age when everything just like I say the wheels came off the bus. Like overnight, everything just changed for me. And I just was so not prepared. I felt very young at 47. It felt very like I was the only one of my friends. Nobody else was experiencing what I was experiencing. I felt very alone. My doctor told me I was too young. They said my blood work was fine, sent me home, and things were not fine for me. So that was my experience. And so I'm
Yeah.
curious as a practitioner, in your experience, give us some feedback on perimenopause, when it can start, what women can look for, and what they need to know to be able to really prepare themselves in finding the right doctor that can support them.
Sure. Lots of questions to answer there. So, number one, you really hit upon something that I see in practice all the time, which is that oftentimes these perimenopausal symptoms will take somebody by surprise. There really is no connecting the dots between what am I feeling? Am I going crazy? Am I having, a medical problem? Is this something super scary I should worry about? And then suddenly having that aha moment that this is a hormonal change that's going on, that's really quite natural. So I think what's changing right now is that there's a lot of education surrounding perimenopause, and women are even coming in asking and proactively seeking information on perimenopause in general. So the word is getting out, is what I'm trying to say. I think the formal definition, perimenopause are the years leading up to menopause, which really is just one day in time when you can look back and say, I have now gone 12 consecutive months after the age of 40 with no menstruation. That's the definition of menopause. Everything after that time is postmenopause or in menopause, and the years leading up to that time is perimenopause. For some women, it can, last a couple of years. For others, it could last up to 10 years. And the main symptoms that really mark perimenopause are usually mood changes like irritability specifically. Sometimes anxiety can be a little bit a part of that. Menstrual changes for sure. So early on, women may have a slight change in their cycle or the duration of it. And a little later on in perimenopause, bleeding habits can skip even up to 60 days or more. And that's sort of a general criteria that we use. But the symptoms are numerous. I mean, I know there are so many pieces that talk about 34 symptoms of menopause. That is really not a medical number. That's just probably a media made up number of all the things that people have been known to complain about. So I would surmise there are many, many more symptoms. But, mood changes, irritability, sleep disruption, hot flashes and night sweats, vaginal changes, sexual drive changes, orgasm changes, you name it, we can likely attribute at least some of it to the hormone changes of menopause or perimenopause.
Well, and other surprising things like tinnitus or frozen shoulder or
Or
yeah, I mean there's so many other like aching bones and joints or
hmm
more injuries, I mean it's the amount of women that I see that all of a sudden have back injuries in their
yeah,
late 40s or early 50s that they have no idea where they got. And that's another thing that happened to me. Like you just woke up with a herniated disc one day. I mean, how does that happen? Right. And so
yeah. I mean, it is so hard to tease out what's going on due to age, due to other medical issues, or is it solely due to perimenopausal changes? So I would like to consider that there really are many variables that contribute, but you are absolutely right. I mean, some of the symptoms are quite unusual. Burning tongue, thinning of the hair, certain skin changes, fine lines, wrinkles, also sagging skin. You mentioned joint pain. That's a very common one, but specific to the perimenopause and menopause population are joint pains in like little joints, like your fingers and your feet. Women will often complain of, I get up in the morning and I just feel like like Frankenstein walking out of the bed until I loosen up. So, uh, like I said, you name it, and that symptom likely has some etiology with hormone changes.
okay, so how do women help themselves during this time period where, like what was happened to me? I went to my OBGYN, she did my
Yeah,
blood work and said, "You're fine, we can't do anything until you have a year without a period." And meanwhile, I'm suffering day in and day out. My marriage is
yeah,
struggling, my work is struggling, my sleep is
sure.
struggling. So it's like give us some tips of things as women in this age range where we can help ourselves.
Well, I would say first is recognition and education. This way, you're not, feeling like you're being hit by a bus with something that you completely do not understand. So, education. I think people take great comfort in community, whether that is in their medical community, their friend groups, their family, but we can glean a lot of information from our genetic family. So, ask your mom, ask your sisters, because it's a high chance that not only the age of onset of menopause, but also the type of symptoms that one is going through, the experience may share some similarities. So that can give you some needed information. I always like to say, for sure, check in with your healthcare provider, whether it's your gynecologist, which is usually the first stop for these types of symptoms, at least in my community, but also your internal medicine doctor or whatnot, just to be sure there's nothing medical going on that is being missed. So, like you said, you got a checkup, you had blood work. This is very important just to rule out other issues that can sometimes have symptoms that will mirror or seem common in menopause. After that, I always start with lifestyle because these habits can take you all the way through menopause and make things much more comfortable. So, diet manipulation, exercise, strength training, which is so important, and flexibility training, stress reduction, which is a huge tall order, especially in the New York City area where I work. You know, stress is part of our DNA, but that can go a really long way. And optimizing sleep. I mean, you're the expert in this field, but we definitely see sleep disruption. Sleep quality really suffers during these years, and there are things that we can do to address it, even simple sleep hygiene habits. There are supplements, drug medications, hormonal medications, really an entire collection of options that can be considered for many of the symptoms of menopause, specifically hot flashes and night sweats, but also vaginal dryness, also some of the mood changes that people may experience, even joint pain. So these are all things that I would have a very lengthy discussion with my patients, and make a shared decision about what's going to be best.
I think that's great. I think the fact that you're working with people in a team approach like that is so
Yeah.
important. I went to, 5 different doctors and each one of them gave me a different pill. Somebody tried to give me a antidepressant and then somebody tried to give me the birth control pill and then somebody, and it's like I went around and I never felt like I had a team. I never felt like I
Yeah.
had a medical provider that actually saw me. Me is what I wanted, me is what I felt would work best for my body. And I even went to a Chinese medical doctor trying to get
Sure.
acupuncture and herbs. Like I was so desperate for something that would give me my quality of life back. And so I know a lot of women feel like having this team approach is really, really important. So I think it's really great that you offer that for your patients and then your clients that come see you. So what are your thoughts on women using hormone replacement during perimenopause instead of waiting until they're postmenopausal? You have any thoughts on
Yeah,
that?
yes, of course I do. I think that this is such an individual decision. And look, there is definitely a group of women who either can't or won't even consider, for personal reason, hormone therapy, or perhaps they have a medical issue which would really preclude safe use. So that's there, and we automatically focus on other options. But otherwise, hormone therapy can be quite helpful, certainly for hot flashes and night sweats, certainly for the vaginal changes that can occur, especially later on in the menopause experience. So that's definitely something to consider. Really, about 20 years ago, there was a huge pendulum shift, if you will, after that big study, the WHI was done and suggested that the risk of breast cancer and other medical issues of a serious nature really were increased significantly with hormone use. This has since been really reinterpreted. And so the fear factor really hopefully will start to come down a little bit, but we haven't seen too much of that yet. But again, it's an individual decision. People feel better with hormone therapy for sure. There are other pharmacologic agents that can be used for symptoms of menopause, but all drugs have the potential for side effects. So we really need to consider somebody's individual symptoms and concerns and beliefs before just honing in on one thing. Lifestyle changes, of course, should be recommended for everybody. I obviously work for Bonafide. We have a lineup of supplements, most of which address very common symptoms of perimenopause or menopause, and they have been well studied. And this is what really attracted me to working with this company, because many supplements are not as well studied. They don't have a lot of scientific information behind them, and ingredients may be suspect. So I find that that's very important. And it was important to me as a physician to feel like I could stand behind that. I would say that, everybody comes in with their own, I don't know, their own story and their own, desires for how they would like to go forward. So I kind of try to discuss the gamut with everybody.
Wonderful. Well, thank you so much for all that you're doing to try to help support women in this space. I wish I
Yeah.
could have found a doctor like you when I was struggling. I'm
Thank you.
52 now, so I'm on the other side of it. And thank goodness I found finally an actual internist that could give me
Yeah.
bioidentical hormones. But it was such a long process for me. And I think it's so
Yeah.
wonderful that there are providers like you that are out in the world offering what you offer, which is that connectivity, the compassion, the understanding, the empathy, the education. All of these things are really inspiring, and we just need more and more of you. So if you can replicate yourself and put yourself all over, we would really appreciate that.
I appreciate that. I will say for your listeners, the Menopause Society, which is sort of our guiding organization, they put out guidelines and whatnot for treatment and such. They really have a long list of certified menopause providers. So people who have taken a significant interest in the space, but also who are trained in managing hormone therapy and other methods of dealing with menopause and perimenopause. So that's a really good resource for your listeners if needed. And
Wonderful.
these are not only gynecologists, some of them are cardiologists or internal medicine doctors. There's also mental health support. So I think that's really great.
Oh, that's wonderful. Yeah, we'll definitely provide a link for that. That's great.
Mhm.
Now, how can women get in touch with you, especially if they're in the New York area? How can they work with you?
Yeah, for sure. Well, first and foremost, the Bonafide website, which is hellobonafide.com, really has quite a bit of information, not only about our products, of course, but we really take significant pride in our blog and educational materials, many videos, many blogs on many of the subjects that we've been speaking about, and they're obviously all medically vetted. Number two, you can look at my personal website, which is drdweck.com, and plenty of information there. My practice is called Well by Messer, and I love it because it is a wellness practice rather than an illness practice. So we really do try to hone in on the prevention and management of things before they are problematic.
Amazing. All right. Thank you so
Yeah,
much for joining me today. Really great.
my pleasure. Thank you.
Thank you.